this class, I'd have time to do reading for pleasure. I'm working on my presentation.
I think I know better by now.
It's a real pleasure to have an alum of the Center for Data Analysis and the Heritage Foundation come back and present work which began while he was here. It was developed, Ray and I have been following it closely over the past year and a half, and now is emerging in book form. And that's work Patrick Johnson's done. I'm so proud of him. Those of you who have not had the pleasure of meeting Patrick should, because he's truly an extraordinary person. At his young and tender age, doesn't look like he's 50, but I'm sorry, that was a bad joke. Not even 25 yet, I don't think. He's done so much, and he's a graduate of University of South Dakota, where he worked in political science and economics. He's won awards for his scholarship and his leadership. He is the author of Cornucopia, a book you're going to hear about this afternoon. He's taken a leadership role here in the policy community and also within his company, Booz, which is well known for being such a quality company. So our job is to help him get ready for an even bigger presentation he's doing. So it's totally unacceptable not to have a question, all right? You would be terribly embarrassing me if you didn't have a question. So have a question. And without further ado, Patrick Johnson.
Well, thanks a lot, Bill. And kind of like you said, it's really fitting that the first time I really speak publicly about all the research and work that kind of went into Cornucopia is back here. I had a great time as an intern and then as a research assistant at the Heritage Foundation, I guess during 2007. And I also had the pleasure of taking Bill and Ray back to South Dakota with me, where they came out and sort of presented a forum at the University of South Dakota, and that was really good. So a couple things just before we start off. I opted to not use any PowerPoint, which is a little unusual because it's consultants, we sort of live in it, and I'm going to try to wing it a little bit without PowerPoint. Another thing that you're going to kind of get from my comments is I'm not really prescriptive about a whole lot here. Really my goal in talking to you is to elevate this issue a little bit, generate some debate and some discourse, and hopefully field some pretty challenging questions and answers at the end that are going to challenge some of the things that I'm going to summarize here. So kind of starting all that out, I want to get a gauge from all of you guys about how well you know or familiar with this topic. So start off, how many of you would say you're very familiar with kind of the connection between agriculture and health and nutrition? Would you just raise a hand? Okay. Somewhat knowledgeable about this? Anybody completely, you're in the wrong room, you know? Okay. So next question is more about just getting you thinking about something. So recognizing that this really depends based on circumstance and a whole number of indicators like that. But what do you think about when you purchase the foods that you eat? You think about price? You think about convenience or quality? Do you pay attention to sort of organic versus non-organic, or locally produced versus non-locally produced? What sort of goes into those decisions you make? Okay, 2 more questions. So the next one, how many of you have seen in the news over the past 2 days that they have released new dietary guidelines through the USD and HHS? Okay. For how many of you do the dietary guidelines have any bearing over what you actually choose to eat? Okay. Last question. How many of you would say that the U.S. is on the brink of a public health crisis? Raise your hand. All right. I'm here to say that the U.S. is most definitely on the brink of a public health crisis. This is a public health crisis that is really being led by dietary disease. So to give you a few statistics to sort of emphasize this point, right now we spend nearly as much money treating preventable dietary disease as we spend on national defense. So, James Carafano, some of the experts that you have here that are talking about defense budgeting and spending, it's pretty amazing to think about all of the military expenditures as they compare to just what we're spending treating obesity and diabetes. About obesity, over the last 30 years or so, obesity rates have more than doubled in the US, to the point where now somewhere around 1/3 of all Americans are considered obese. about 2/3 of all Americans are overweight. And the amazing thing is that these numbers are actually continuing to trend the wrong way. By 2015, somewhere around 3/4 of all Americans are going to be overweight or obese. And 1/4 of all children and adolescents, I believe that's calculated up to the age of 19, are going to be overweight or obese. This is a major challenge. When we look at the cost of treating these diseases, just for obesity alone, that cost is projected to grow to over $340 billion by 2018. That's about 1 in every 5 healthcare dollars that we're going to be spending. And the cost of obesity also isn't just what we're paying treating it. One of the most interesting statistics I came across when I was kind of doing some of this research is that the amount of extra jet fuel airlines have had to purchase to actually fly overweight Americans around the country is equated to about 350 million gallons over the last 10 years. So, when you're kind of looking at the price of a plane ticket, there's a lot more than just these really expensive and, I think, unnecessary security measures. You can look at the person sitting next to you and if they're flowing into your seat. So that's obesity. There are also some challenges here with diabetes. Now, obesity and diabetes are closely linked. About 90%, and I'm just talking about type 2 diabetes here, about 90% of people with type 2 diabetes are also obese. And obesity rates have more than doubled over the past decade, where we now have about 20 million Americans are considered diabetic. And even more alarmingly, we've got about 54 million Americans who suffer from prediabetes. Taken together, over 1/5 of our country there is diabetic or has prediabetes. Now, this isn't a disease that just goes away. Now, while about 80% of these cases are actually preventable through diet and exercise, and even the people with prediabetes can help stave off kind of the full onset, it's a major challenge. And when you look at what being diabetic means in our society, it means less mobility. It means less opportunity to hold down a job. It means that you aren't as active in your parenting and all these other things. So it also poses a number of kind of social challenges. And the cost of obesity and diabetes together, diabetes cost is also forecasted to be around $300 to $400 billion over the next decade. So taken in sum, you're talking about 3/4 of $1 trillion on those two diseases. And this doesn't even get into the other diseases, chronic diseases that are closely linked, such as hypertension. Okay, so dietary disease, obviously an output of diet in some sense. I mean, that's why they're called dietary diseases. And so here it's sort of helpful to think about what the American diet is, and sort of try to understand how this happened and how we sort of ate ourselves onto the precipice of this cliff. So to start, it's interesting because if you guys all think about the word diet, you probably think of something completely different than what most of the world would think of diet. Most of the world diet would mean their national foods and the culture and the eating habits. Here it's about the Atkins diet and the South Beach diet and lose 5 pounds in 5 days in 5 minutes and look great in your swimsuit in 2 months. It's different. If there were sort of 2 words I would use to describe the American diet, it would be it's fast and it's cheap. Just how cheap? About half of what other developed countries pay on food. We're spending under 10% of our income on all food expenditures. This would include meals prepared in the home. It would include meals prepared that end up getting thrown away. And it also includes all restaurant meals. When you look at the amount of time that we spend eating, that's also fallen to somewhere around 30 minutes for actual preparation and cleanup. It's phenomenal. 1960 was over an hour. Now we're down to 30 minutes of cleanup and preparation. That doesn't account for the time you actually spend eating your food. And kind of interesting for my demographic is 1/3 of all of our eating actually occurs in the car, if you go by statistics. So one of the other characteristics kind of unique to the American diet would be a very heavy emphasis on nutrients and nutrition. And this is actually, and it's funny because the more we pay attention to nutrition, it seems the less nutritious we become. But scientists have actually coined a whole new term around this called nutritionism. At its base level, nutritionism is what happens when we deconstruct all the nutrients out of the whole foods context. And if you look at any box of foods or the sodas that are sitting in front of you, you've got mandated by law little labels on there. But if you look at the soda, it will tell you how many grams of protein, which is 0. It'll tell you grams of fat, which is 0. carbohydrates, which might be, I don't know, 7%, 8%, something like that. Then if you look at the bottom, it will say how many grams of sugars are in it, but it won't actually affix a percentage to it, somewhere around 20, 30 grams of sugars. We know, because there have been a bunch of studies that have recently come out, that food labels actually influence what people end up buying. And so you see a lot of, no fat, low sodium, healthy, heart healthy, all of this stuff. And that actually encourages what people buy. And we'll go back to the way these soda cans are labeled later on, get to kind of some of the recommendations. So nutritionism doesn't really work, because I know that if I stay at home and eat chocolate and then just pop a multivitamin before bed, even though that says that I got all the vitamins I needed for the day, and maybe I'll have a protein shake too, I'm not going to be in good shape. Like, it doesn't work that way. And this can be traced all the way back to like the 1920s with the invention of Wonder Bread. It was really interesting because that's when scientists realized that they could take really nutritionally worthless, refined, highly enriched grains and then infuse it with vitamins, and all of a sudden parents were buying it, off the shelf for their kids because supposedly it's healthy now. So, another thing to look at is kind of calorie intake. And this is actually kind of tied to 2 points here. So the amount of food, we're getting heavier. It means that we're either eating more food, we're being less active, or some combination of the two. I can say most definitely that we are eating more food, somewhere around 500 calories more per person from today versus maybe 1970. But again, if you're looking at where the calories come from, that's really more important than the number we're consuming. And so one of the things I'm arguing is that where our calories are coming from is just as important as how many we're consuming. Now, I'm sure that one of the questions that you guys might be thinking about is, okay, so we're getting heavier, but this is just a sign of being in a rich, developed country. Look all over the world. I mean, in Europe, in Australia, in certain parts of South and Central America and Asia, when people get richer and older, they put on weight. That's true, but it's interesting to think that when Americans move abroad, they uniformly lose weight, and when foreigners immigrate to the US, they uniformly gain weight. And so you have to think that there's something going on in the water. I'm not really sure. One other note that I'm not going to go into a lot of detail here just deals with kind of the USDA and HHS's dietary guidelines. Now, these are released every 5 years or so by law. And the ones that were just announced yesterday are actually probably the best dietary recommendations that have ever come out. But one of the things that's really peculiar about them is it will and this year they took a few incremental steps in the right direction, but it's always around eating more. So it's eat more fruits and vegetables, eat more nuts and poultry and eggs and seafood, eat more lean meats, eat more whole grains. All right, you are going to hear eat less. Actually, it did say eat less, but it said eat less sodium, solid fats, I don't even know what a solid fat is, and enriched grains. So basically, it wasn't always this way. First dietary guidelines was kind of a creation of one of my South Dakota compatriots, George McGovern, and he chaired a Senate committee, I think it was 1977, around health and nutrition, because in the 1970s, America's diet really had an influx of red meat, and heart disease was going up. So to combat that, McGovern chaired this committee. They were looking at the foods that Americans consumed. They came out with pretty sensible recommendations. To sum it up, eat less red meat, eat less dairy products. What happened? The very next time McGovern was up for re-election, he gets booted out of office because the cattle lobbies, the dairy lobbies, and all of these other kind of big agribusinesses got behind him, funneled a ton of money into the opposition, and he was out of office. So a lot of politicians sort of learn from that experience, and you don't see a whole lot of people going up against these major companies telling people to eat less of their products. All right, so that's sort of the American diet. One of the interesting things here is to look at how the American diet is tied into US agricultural policies. This was actually my initial research question. Does US farm policy